Hi, everybody. I'm Andy Bozarth, Director of Community Outreach and Advocacy for AARP Kansas. Welcome to the Coffee Chat. Today, we're very lucky we're being joined by Attorney General Derek Schmitt, who has taken time out of his busy day to come and talk to us about elder abuse and fraud. Thank you, Attorney General Schmitt, and welcome.
Thank you, Andy, very much. I'm glad to be with everybody today.
It's wonderful to have you here. And just for those of us who are a little bit questioning what it is the Attorney General really does, could you explain a little bit about what your job is?
Well, if you don't have on the tip of your tongue what the Attorney General's office mission is, that means you're with the majority of Kansans. And I often tell our folks, if we're doing our job good and well and professionally, we want that to be true. We don't want people worried about how we're working. We want them focused on living their lives, and we're available to help when needed. So we have a wide range of duties under state law, most of which most folks will never see. We're the state's defense lawyers when the state is sued. We help local county or district attorneys in criminal cases where they ask for some assistance. We do Medicaid fraud enforcement work. But a big area that's relevant to us today, we spend a lot of effort on combating elder abuse or abuse of dependent adults. We do a lot of consumer protection work. And on our watch, we've really tried to make that a priority because we think it's an area we can make a big difference for Kansans.
Well, it sounds like you stay very busy, and we appreciate all that you do, especially for the older Kansans. You talked a little bit about scams. Can you tell me some of what the most common scams that your office has seen in the past year are?
Yeah, well, of course, COVID is such a big part of all of our lives now. And so what's become increasingly common, and we've seen in the last 11 months that we really hadn't seen before, are new spins on old scams where the bad guys try to tailor their old scams to COVID. And so, we're seeing scams where the fraudsters, the crooks, they offer assistance in getting federal aid or a stimulus check that everybody's read about in the news or learned about from watching TV or online. Well, the stimulus checks are real, but the offers to provide help in getting them or getting them quicker, they're not real. You don't have to do anything to receive your stimulus payment. It will come automatically from the federal government. And if you have any questions, you contacting, for example, the Internal Revenue Service directly or reaching out to your member of Congress for help, okay, that's a way that you can seek some answers. But for goodness sake, don't click on an email that comes in or respond to a direct mail piece in your mailbox or deal with a telemarketer who promises if you'll just pay them a little bit of money or give you their bank account number, they'll help out in making those payments come in. We've also seen plenty of quick cure type scams where people are worried, of course, understandably, about COVID and the potential health effects. And so some of the fraudsters have decided to prey on that by, again, promising if you'll just pay us some money, we will get you access to this new remarkable cure or a way to help prevent COVID or other things to keep you healthy and safe. And of course, it's always good to listen to your doctor, to listen to the local health and medical professionals that are known and trusted. But it's not a good idea to, again, respond to an email or a telemarketing call or a piece of direct mail that promises to keep you safe and healthy. That's almost certainly, not almost, that is a crook or a scammer.
And the crooks and scammers get more and more creative all the time. It's amazing what they can come up with as a way to take advantage of you. So
yeah, go ahead. Sorry.
What if somebody I know has become a victim to one of these frauds or scams? What should they do?
Well, of course, if somebody's in immediate danger, the first thing to do is call 911, just like any other sort of crime or harm that's brought to somebody. If it's not somebody in immediate danger, if it's, I think I've been swindled or scammed and I want somebody to check it out and see if they can help me with that, obviously it's always just fine and a good idea to contact your local law enforcement agency, your police department locally, or your sheriff's office locally. They're the front line for Kansas law enforcement. They know the community the best, and they're there to help. Often they will suggest, or you can just directly contacting us at the Attorney General's Office Consumer Protection Division, where we have a dedicated staff of professionals, investigators, and consumer specialists who will sort of walk people through the process of how to file a complaint with our office. We can initiate an inquiry or maybe an investigation, and we'll see if there's anything we can do to help. Of course, that can be done online at our In Your Corner Kansas website, inyourcornerkansas.org, or by phone. We have a statewide hotline at 800-432-2310 that goes directly to our Consumer Protection Division. And of course, in a case of serious elder abuse, in addition to contacting law enforcement or contacting us, it's also certainly fine and maybe a good idea to contact the abuse hotline that's run by the social service agencies. And so those are all options. But, one of the real keys is do tell somebody and do ask for help. There's no reason to be embarrassed. That's what we're here to do, is to help when that happens.
That's a very good point. I know that once people have been taken advantage of, a lot of times they don't speak up because they do feel embarrassed. And one of the ways they can deal with that is by going to your website or calling you. And those numbers and websites are scrolling at the bottom of this in case you want to get in touch with the Attorney General's office. And Attorney General Schmitt, we have a question from the audience, if you'd like to take that.
Please.
The question is, are you seeing a problem with creating phony vaccine cards or using info from legitimate vaccine cards to steal IDs from what people post on Facebook? That's a very interesting question.
Well, we have seen reports from around the country of a whole range of vaccine-related scams, whether it's the particular question that was just asked, or more generally, crooks and criminals using their old tricks to try to get people to give up personal information on a promise that it will help get your vaccine access sooner, or other types of things like that. Our best advice on that is, as with everything, don't suspend common sense. We know that there are many people who really want their vaccine and they want it as soon as possible. And we get that. We respect it. But the bad guys understand that too, and they are preying on that sort of anxiety or anxiousness. So again, if you're looking for a vaccine immunization, the best thing to do is contact the local health department, to contact your local doctor or medical provider, and to get the best available local information about how to make sure you get your turn for the vaccine. It is not to respond to something you've seen on Facebook or something you've seen online or a telemarketing call that comes in, because those aren't going to be real health officials. Those are going to be people trying to get your personal information or otherwise get access to your pocketbook.
Yes, that's very true. For those of you just joining us, I'm Andy Bozarth, Director of Community Outreach and Advocacy for AARP Kansas, and we are joined by the Kansas Attorney General Derek Schmitt today. If you have any questions, please feel free to put those into the chat box, and I'm sure the Attorney General will be happy to answer your questions. Attorney General Schmitt, you are very committed to protecting elders during your stay in the Attorney General office, and you've been really good at basically fighting elder abuse. And can you go into a little bit more about how your office is doing that and what steps you've taken as Attorney General to fight elder abuse.
Yeah, I appreciate your mentioning that, Andy. We've worked very closely with AARP and many others who are similarly committed to fighting elder abuse of all sorts, whether it's financial abuse, either by a remote crook or scammer, or sadly, sometimes by a trusted individual who has access to a vulnerable adult, or whether it's physical abuse that does happen, obviously, more than anybody wants in some situations around our state. And one of the things we realized early in our service was that having the tools to respond to those sorts of abuse is really critical. If you don't have the right tools, it's tough to do the job right. And the tools were available more readily in some parts of our state than in others, which is not a criticism of the leaders in those areas of the state that don't have the tools, but they didn't have the tools. And so, for example, there is tremendous capacity among law enforcement, social service agencies, private groups, others in Johnson County. They work very well together. Same in Sedgwick County, and same in some other parts of our state. But in the more lightly populated areas where resources are more of an issue, sometimes those tools weren't available to law enforcement or others. And so one of the things we started doing early on was figuring out how we could try to step into that gap and provide access to those law enforcement investigation prevention tools in areas of the state where they were lacking. Working with the legislature, we were able to create our Fraud and Abuse Litigation Division at the Attorney General's office. It does some abuse, neglect, and exploitation prevention and investigation work. It also works closely with the Securities Commissioner and the Insurance Department to deal with financial fraud that rises to a criminal level. It's more than our consumer protection work. It actually requires a criminal investigation and, if appropriate, a prosecution. It works closely with victim services folks around the state to make sure as best we can that people who become victims get connected with victim service opportunities on the back end to help them work their way through what's happened to them. So, and it does most of its work in those parts of the state that don't already have the tools, don't already have the capacity. We're trying to fill that gap. Another thing we've done related to that, and AARP has been so very helpful in this, we created an advisory council to get everybody around the table who are really the leaders on adult abuse and senior abuse prevention and response in Kansas. You all have a seat at our table. And that's provided a forum so that we can do better as we move forward in figuring out what additional tools do we need and where do we need them and where are we seeing problems and are the problems connected to people with potential solutions. And big picture, just how do we do a better job of protecting seniors from fraud and abuse? And so that's going to be an ongoing work, and we're proud of it. We know we have a ways to go, but we're better off than we were before.
Yes, and you've done an excellent job in fighting elder abuse and coming up with new and innovative ways to do so. And with Kansas being a rural state, what has the Attorney General's office done to help some of those rural counties that don't have the same kind of access to services as the larger counties?
Right. Well, one of the things we've done is just make sure there are people to answer the phone and respond. When we get an inquiry from a small county sheriff's department or police department saying, we have an elder abuse case and we need help with that. So we do have a very small capacity, but we have a capacity to actually deploy our agents to go assist in an investigation. More often, what we do is make sure that other resources in Kansas that can be helpful are connected. So we can talk local authorities through how to investigate one of these cases. We can provide, in a financial abuse case, we can provide some financial analyst work on the back end. Sometimes that's the sticking point, because a financial abuse case, there can be thousands of financial records, and somebody has to help local authorities get them all sorted out and usable to figure out how to follow the money, figure out what really happened. In other cases, we'll actually, at the request of local authorities, send our folks to step in and prosecute a criminal abuse case when that's necessary. And of course, in the big picture, we've continued to work very closely with our private partners like AARP and also with other government partners around the state to try to do more awareness, like we're doing right now in this conversation, to help prevent elder abuse in the first place, to help elders, seniors be aware of what the bad guys are up to so they can keep their guard up and not lose their money in the first place, and to help others who have access to and work with seniors or other vulnerable populations, folks who work in our long-term care facilities, our nursing homes, who otherwise interact with seniors frequently, to help make sure they have the appropriate training to know what the signs of elder abuse may be so they know what they're seeing and therefore that they need to report it to the proper authorities. So we've really tried to help be partners in building that capacity in parts of the state that on their own haven't been able to develop it to the extent they would like.
Yeah, and I can't emphasize this enough. The Attorney General's office has been out in front with fighting elder abuse and fraud in Kansas, and we are so appreciative of that. And Attorney General Schmitt, we have a couple more questions from the audience. The first one is, would someone advertising phony vaccines be potentially liable for more serious charges or a civil claim if a victim of the scam later died from COVID-19?
Yes, is the short answer. It is illegal to advertise or sell a fake product. And obviously, in the context of vaccines, advertising or selling a fake product that either does no actual harm but also no actual good, so it gives somebody a false sense that they've been protected from COVID, or worse, that does actual harm because the material that's represented to be bona fide vaccine is actually something that will hurt a person if it's ingested or injected into their body. Those are crimes, and they are crimes that need to be, when they're seen, they have to be reported to law enforcement, investigated by law enforcement, and when the evidence is available, prosecuted to deter others from doing them. And I will say that we are dedicated to helping our local law enforcement and prosecution partners when they need help on something like that. And we're also dedicated to working with our federal partners in the U.S. Attorney's Office, the FBI, the Department of Health and Human Services. We all work very well together. So when a report like that comes in, we make sure the right folks are on it as quickly as possible.
That's great. We do have one more question. What is the top scam that you're hearing about from consumers in Kansas?
You know, robocalls remain the number one complaint. Now, obviously, there's lots of different content for those calls, so there are different types of scams, but the number one complaint is robocalls with a scammer on the other end who's impersonating a government official. We're with the IRS. We're here to help. You have taxes due. You have to make a payment right now. We already talked about the COVID types of scams. Many of those come in over robocalls now. We're here to help you out getting your stimulus payment if you'll make a payment to us. We're here to help you out with getting priority for the vaccine if you'll either make a payment or give us your bank account or give us your social security number. So robocalls remains the number one category. And of course, our advice, I know it seems simple, but it's true. Just hang up if you've answered the phone. Don't engage them in conversation. And better yet, just don't answer the phone in the first instance if you can have the self-restraint to do that. But I know that's tough sometimes.
That is tough. I always tell my parents, do not answer the phone if you don't recognize the number coming in. And that's not only my parents, I tell my son that also. We have another question if you'd like to take that. And it is, are there any scams that target military vets?
Yes, we have certainly seen those over the years. They come and go. And sometimes they seem to run in clusters. I think, and this is just anecdotal, I think that whenever there's some military matter that's in the news, the scammers sort of step up their efforts on targeting veterans, probably because they assume that because military affairs or veterans affairs are in the news, that people will be more apt to engage with them in conversation, which is what they're really looking for. If they can get you talking, get you answering their emails, get you responding to their direct mail, get you talking to them on the phone, that's how the scammers then try to persuade you to let your guard down and think they're legit when they're not. Mm-hmm. The types of scams targeting veterans vary over time. We see them in different clusters at different times. Sometimes the intended victim are veterans specifically. And in fact, I was just talking yesterday with a fellow who is a veteran, and he was looking to get the COVID shot for himself and his wife, and she is not a veteran. And he was concerned about some solicitations that had come in offering priority in COVID shots for veterans and their families that were not true. Like we were talking about earlier, it was a bogus scam. It wasn't real health officials. It was somebody making a false promise to help veterans and their families, using the COVID situation and the fear that surrounds it to really get people to let their guard down. And the goal is to get money or personal information. If you're a veteran and you need assistance with COVID, your medical provider, your county health officer, the VA, those are the places to turn for help, not your email inbox or a Facebook posting or a phone call that comes in. We've also seen veterans-related scams where the intended victim is not the veteran, it's the general public, whether it's a senior or somebody else, but the crook, the scammer, uses the support for the military and veterans that we all have to try to trick people into parting with their hard-earned money. So we've seen scams where somebody claims to be raising money for a charitable purpose that's going to help and support veterans. It's going to help and support wounded veterans. It's going to help and support our men and women serving in the military who are deployed overseas. It's going to help and support the families left at home while a service member in the family is deployed. Obviously, there are good causes there, and when they're legit, those are great things if people want to provide that help. But we need to be mindful that the crooks and scammers are in that space too. And of course, if you want to make a charitable contribution for those purposes or any other purpose to support a good cause, the best advice is sit at your breakfast table or wherever you make these family life decisions, put the phone down, turn off the computer, and just decide yourself or with your family what causes you want to support, how much money you're willing to give to support them, and then you reach out affirmatively to those charities and make the offer. Don't respond to the solicitations coming in. It's better if you're in control of your own charitable support.
Absolutely. And I really want to emphasize that again. If you want to make a contribution, you reach out. Do not respond to somebody contacting you. That's excellent advice. Again, for those of you just joining us, I'm Andy Bozarth, Community Outreach and Advocacy Director for AARP Kansas, and we're joined today on the Coffee Chat by Attorney General Derek Schmitt, and he is taking your questions. So if you have a question, please feel free to put that into the chat box, and I'm sure he'll be happy to answer. I want to kind of turn a little bit. And I know AARP testified in favor of House Bill 2151 recently, and that is a bill that your office introduced. So can you tell us a little bit about what 2151 proposes and how the bill actually came about?
Absolutely. And again, I very much appreciate AARP's support for what we think is a proposal to make some very good public policy that can help us do a better job of protecting seniors and dealing with elder abuse all over our state, not just in the larger jurisdictions that are already, for the most part, doing a good job. So that piece of legislation was studied and recommended to me, to our office, by our Elder Abuse Prevention Council that AARP sits on. That's the group we talked about a few minutes ago that we put together to take a look at what next steps we can take together in Kansas to do a better job of protecting seniors from abuse, neglect, and exploitation. One of the things that they observed was that, as I've already suggested, in Johnson County and Sedgwick County, for example, they do a very good job of the right hand and left working together, sharing information about trends and elder abuse cases, making sure that the social service officials and the law enforcement officials and the prosecutors, and when appropriate, private partners like an AARP or the banks who often see evidence of elder financial abuse, that all of those folks are regularly partnering, working together, and pulling in one direction. And it's made a real difference. We don't get so much this silo effect in those bigger counties where the one agency knows something and another group knows something else, and they're not talking to each other, so the problem goes unaddressed for too long. What our legislation that we're talking about here would do is take that same concept of what they call a multidisciplinary team, lots of different folks looking at the problem of elder abuse from a different perspective, and try to translate it into other parts of Kansas outside of the larger metro areas. And it's an easy concept, but it's difficult to accomplish. That's why it's taken so long to get this proposal together. And I'll spare you the details on why, but just think about this. If you're in Johnson County, where they do a good job, because most of your agencies have one county of jurisdiction, and a lot of your groups that fight elder abuse focus on Johnson County specifically because it's the biggest county in the state, and there's a lot of effort needed there. And the district attorney has one county in jurisdiction, and the sheriff has one county in jurisdiction. It's relatively easy to get all those folks in a room focusing on common problems. But if you're, for example, down my way from Independence in a more rural part of the state, and you might have a 5 or 6 county area served by DCF, and a multi-county area that's not the same 5 or 6 counties served by KDADs, and you have 5 or 6 different county attorneys, one in each county, and you have maybe 20 different law enforcement agencies that all have county boundaries, along with other groups, it becomes much more difficult to put everybody at a table to focus on common problems. So this legislation is designed to get us over that hurdle, and we're really hopeful it's going to pass this year because we think it can make a real difference in protecting seniors.
Yes, thank you for explaining that. And we're real excited about the bill. We believe strongly that it could help very much in fighting elder abuse and fraud against seniors. Again, that House bill is 2151. And if you're interested in protecting seniors, look that bill up, see what it says, and contact your representative and ask them to support that bill. We are almost out of time. So are there last words of advice you'd like to give to the audience?
Well, I know I sound like a broken record, but the old advice that if it sounds too good to be true, it probably is. It's old advice for a reason, because it's correct. And so we just remind folks, the crooks and the scammers and the fraudsters and the abusers, their bottom line is they want to take advantage of you, get your money, or get your personal information to use to get the money in some other way. And so don't let your guard down. Be cautious. Just use common sense. And if you see something, say something. If you think you've been the victim of abuse, or your friend or your loved one or somebody you go to church with has, tell somebody about it. Report it to law enforcement, report it to us. If you're not comfortable doing those things, I hope you are, but if you're not, at least talk to another trusted person in a leadership position, even talking to a pastor. I mentioned church, or talking to your legislator, or whoever you're comfortable with, because you want the news to get reported so we can help and try to prevent the harm. So don't suspend common sense. If you see something, say something.
Thank you, Attorney General Schmitt. We appreciate your efforts so much, and keep up the good work.
Thank you, and you too.
Those of you joining us, thank you for joining us today, and we'll see you next week at the same time, same place.